I remember sitting on the other side of this observation window in a feeding clinic, and I'm watching this child eat yogurt. I remember being in that observation room and kind of like looking at the mom. Again, the trust that that person has to have in a professional to help their child with something that seems so basic but is all-consuming. It's a big deal, and I wanted to be involved with that. My specialty and area of interest is pediatric feeding. So I work with kids who have pediatric feeding disorders or struggle to take in a good amount of food to stay healthy. We see kids anywhere from 12 months up to about 12 years old, and it's wide ranging. Some of the kids are typically developing and are older and struggle with food. Some of them are younger and more medically complex and may have some more medical reasons or mechanical reasons why they struggle to eat from a skills perspective. We are a transdisciplinary feeding program, and so we've got psychologists, behavioral health clinicians, occupational and speech therapists, and dietitians, and then we also have our pediatricians who come and make sure the kids are medically stable. And we spend about 2 hours talking with the family about the child's feeding history, just getting a really good idea, not just how the child was born and like early development, but then also where things seem to have gotten stuck or gone off course. How are they being nourished? Sometimes it's by mouth, sometimes it's not by mouth, and we have to understand that. We need to understand their oral motor and oral sensory profile. Is everything okay? Or is that something that's a challenge? And then what are some of the maintaining sort of behaviors in their system, both individually and in their family, that may make feeding difficult. We meet them on a weekly or bi-weekly basis, or monthly, depending on what the family needs. And they come in, we do food exposures, and then we also send them home with homework and things to practice in the meantime. I often say parents are my favorite brand of human because they are amazing. No one loves like a parent loves. It's very exciting and also very rewarding to be able to help a parent feel like they can do a good job just keeping their child alive. We can help kids thrive and just experience a more normal life. When I'm not in the hospital, not surprising, people in feeding love food. So I like trying different ethnic cuisines.